Dun, dun, dun. Hey everyone, good day to all. So today we are going to discuss about our remaining 51 liners. Okay, so this is total of 100 one-liners. So as we already discussed the first 50, the next one is the today we are going to discuss the next 50. Okay, and 50 to 100. Okay, so guys, for the PDF, the link in already in the description. Okay, if you have any doubts, you can just WhatsApp me. Okay, or else you can follow me on Instagram. That is Dr. Omiprazole 40 milligrams. Okay. So guys, if you see the PDF, guys, to see the one-liners, guys, if you compare, if you compare the others one-liners PDF, guys, so mine is very unique. You can just see mine is very unique. Okay, now so that's why because of I don't want to give just a hint. Okay, I just want to give everything in details in the one and on one liners also. Okay, na? So let's go. We are here. We are done here. Here, okay. 51. Okay, next one. 51. Okay. Here is the first question. Jay Sri Ram. The first one is the nephrotic syndrome. What is the drug of choice? This is the simple question. Everyone knows. Okay, it's a prednisone corticosteroid. That's it. Okay, sir. Let's learn. Nephrotic syndrome is also called as pathological proteinuria. Also called as pathological proteinuria. What is the definition? Definition. You have to remember. This is very important. If the urine protein is more than 1000 milligram, okay, meter square per day. This is per day in mg. If the spot urine protein is more than 40 milligrams meter square hour, per hour, the spot urine protein and creatinine ratio is more than 2, then this is comes under what? Nephrotic range proteinuria. So these are the definition of the definition of the nephrotic syndrome. These are the questions they are going to ask in the exam. Okay, na? So you have to know the values are very important. What is the drug of choice? It is corticosteroid, that is prednisolone. How much you have to give? 2 mkd. This is the starting dose. For how many weeks? 6 weeks. See, very simple. Very simple here. Okay. I said now already. My PDF is very different. So you will know many things here. How many weeks? 6 weeks. After 6 weeks, we have to decrease the dose. How much? You have to take 1.5 mg mkd. On alternate days, you have to give total how much? Again for the 6 weeks. Then how much total duration is? 12 weeks. So this is the question. Duration is 12 weeks. First, how much? 2 mkd. Then 1.5 on the alternate days. Okay. What is the maximum dose per day? You have to give 60. Maximum is the 60. Okay. Maximum. Okay. Done. Next one. What else they are going to ask? They are going to ask you. Okay, here. What is the drug of choice for the steroid-dependent nephrotic syndrome? It is the levamisole. It is the levamisole. Dose is 2 to 2.5 milligrams per kg per weight. Okay, now we have to give this on alternate days. Okay, now it is a steroid-sparing agent. What is the side effect? It is the leukopenia. Okay, there are many drugs which are used for the steroid-dependent nephrotic syndrome. You can check in my in my Telegram, guys. I already shared there. Okay, what is the drug of choice for the steroid resistant? It is the cyclosporin, which is a calcineurin inhibitor. That's it. See, you got to know many things about nephrotic syndrome. These are very important. Tell me, which is the most common? Which is the most common cause of the nephrotic syndrome? It is a minimal change disease. In children's, it is a minimal change disease. Okay. What about in adults? It is the FSGS. It is FSGS. I will tell you one thing, one trick here is that if examiner is asking about FSGS, they will give the history that his patient is what he's having HIV. Mostly HIV patient is having what FMGS. Okay, na? In children's, it is the most common. It is the minimal change disease. Okay, na? Why it is called a minimal change disease? Because on light microscopy, the findings are normal global ray. On immunofluorescence, nil, and on electron microscopy, there is a effacement of the food process of the what? The basement membrane. Okay, na? There is a effacement of the podocyte food. Okay, na? That's why they will tell you on light microscopy what is you are going to see. Effacement of no, it is on electron microscopy, not the light microscopy. Okay, na? Done. Next one. Next question. See, PSGN versus IgN nephropathy. How you are going to differentiate between these? Okay, see here. In both types, there is a hematuria. There is a gross hematuria, cola color urine. Okay, na? There is gross hematuria, cola color urine. Okay, na? See here. Okay. See, this is the in this one, hematuria. See, first of all, a patient, a small, a baby boy or anything, or anyone, okay, na, baby girl, adults, okay, na, but it most commonly in the children's only, okay, na. Suppose example, a baby developed, okay, a baby developed skin rashes or sore throat, okay, na. After getting sore throat, after 2 to 4 weeks, after 2 to 4 weeks of the infection, they developed a gross hematuria. Gross hematuria. Okay, now then it's a PSGN. PSGN. Remember here, after developing here, see in this case, the child develops sore throat or skin manifestation developing within 3 days. Within 1 to 3 days only, if he get the gross hematuria, within 1 to 3 days only, it is called as IgA nephropathy. Got it? This is how you have to differentiate between the PSGN and the IgA nephropathy. What is the most common cause of the PSGN? It is the IgA nephropathy. Okay. See here. You can see here, but these are the most important. How you're going to differentiate. Okay, na? See here on immunofluorescence, you will see the starry sky appearance. This is a starry sky appearance here. Here there is a IgA based immune complex deposited in the mesangium. On electron microscope, there is a mesangial immune complex deposition. Okay. The next one, hello. Chappu fast chappu. Class up. Chappu. Sir, okay. Okay. Next one, Next one. Conjugate first. This one, this is very important. Okay. Conjugated hyperbilirubinemia is also called as direct C, DC. Array what writing? Okay, DC. Okay, na? Remember DC. Conjugated, also called as direct hyperbilirubinemia. See, remember here remember in exam, okay, how they are going to ask you which are the following which are the following syndromes, diseases are associated with the conjugated hyperbilirubinemia. Okay, na? That's how they will ask. So you will remember, okay, doctors, okay, remember doctors are conjugated. So, okay, Dewey-Johnson syndrome, Rotor syndrome, these are conjugated. What if they are going to ask you what is the defect in the Dewey-Johnson syndrome? Then, my goodness, that guy, he told me that just remember doctor conjugated. What is this? What is this? Why they ask what is protein? What is defect? Remember here. This is Dewey-Johnson syndrome. Okay, na? See, Johnson syndrome. This is Johnson. This is a Johnson baby. Johnson baby powder. There is a Johnson baby powder. Okay, na? What is the MRP? What is the MRP? It is very high. You will then, if it is very high, you will see, why there is a defect in the MRP. There is a defect in the MRP2. Okay, na? Got it? Next, there is a dark pigmentation of the liver. They are also seen in the case of the Dubin-Johnson syndrome. D for Dubin, D for dark. Done. Next, coming to the Rotar syndrome. Defect in the organic anion transport protein. See, this is the rotor motor transport. Rotor motor. This is the transport. Okay, this is a transporter. This is the transporter. What transporter? Anion transporter. Defect in the organic anion transporter protein. Done. Next one, come to unconjugated. If you remember the conjugated, this doctor DR, then remember the unconjugated. Here what happened, Amma? Here what happened? There is a complete absence of. There is in type 1, there is a complete absence of the UDP glucuronide transferase. Okay, now there is a complete absence. If there is complete absence, then what happened? Then this one, then unconjugated will not going to convert into conjugated. So what happened? The complete option will going to be most fatal. Coming to the Crigler-Najjar type 2, it is the partial absent. It is the partial absent of the UDP. Next one, coming to the Gilbert syndrome. Gilbert syndrome, what happened? There is a mild absent. There is a very, very mild. But here what happened? You will see the symptoms of the Gilbert syndrome whenever the patient is feeling stress, illness, or fasting. You will see that there is a hyperbilirubinemia. Okay, now only the mild conditions only. Okay, now so remember here. Remember, all are autosomal recessive except type 2. Here Crigler-Najjar type 2. It is the autosomal dominant. Okay, now remember this is the. Remember, sometimes this Gilbert also shows the autosomal dominant. If Crigler-Najjar is type 2 is not there in the option, then you can go with the Gilbert. Okay, done. Next one, celiac disease. Okay, now there is a villus atrophy. There is a villus atrophy. That's why there is a watermark. There is a malabsorption. Okay, now whenever a patient will come to you and he will say that doctor, whatever I am eating, okay, whatever I am eating, it is what happened. It will be coming like in the stool. Okay, now he is passing the stool. Whenever he was eating, he is passing the stool because of the malabsorption. Okay, now this is the case scenario. What is the most sensitive test? What is the screening test? Is the anti-TTG, IgA, and the total IgA. This is the most antibody. This is the most sensitive test. What the most specific test? It is the what? Anti-endomysial antibody. Okay, na? Done. Remember, what should be avoided in the patient with the celiac disease? You have to avoid the barley, bread, oats, rye, wheat, and suji. You have to avoid this one. Okay. Next one. Here is a bulimia nervosa and a bulimia nervosa and a anorexia nervosa. Here, see here what happens in the bulimia nervosa. See, bulimia nervosa means what, Amma? He is bull eating. Bull eating means he will eat many food. He will eat so many food. Okay, na? He will eat very large amount of food in a very short duration. He will eat a large amount of food within a very short period. After that, he will feel that, oh my goodness, I ate so much. That's why he will induce the purging. He will do the purging. He will put two fingers in your mouth and he will he will do the purging. Okay, na? He will do the purging. So what happens, Amma? All the acidic content will be come out. So there is in body what happens? There is a metabolic alkalosis, hypochloremia. There is a electron imbalance also. So whenever he will put the finger in the mouth, okay, na? Then what happened? There is a mild injury with the teeth here. That's why that injury part on the index finger and the fingers, what happens? It is called as Russell sign. Then what happened here? The BMI will be more than 18 only because he is eating now. The next one, there is a tooth decay also in the case of the bulimia nervosa because of the acidic. Next one, anorexia nervosa. What happens here? He will not eat the food. Even though if you give the food, he will not eat. He will always see himself in the mirror that, oh my goodness, I look very fatty. My image is not good. So he will not eat food. He will restrict to, he's having a restrictive type of eating. He will not eat. Even though he will eat the food, after that, he will do the purging. Okay. That's why there is a what? Malnutrition. And the BMI will be obviously there is a less than 18. That's it. For the drug of choice, the fluoxetine and the you have to do the behavioral therapy. That's it. Next one, PTSD and the ASD. What is PTSD? Post-traumatic stress disorder. There is a what is ASD means acute stress disorder. Acute stress disorder. How you are going to differentiate? In the last NEET PG examination, they asked this one. They gave one scenario is that. So, for example, a girl coming to home by his dad on the bike. Okay, now suddenly bike hit to a car and he lost his father, and she is the witness there. After that, she is having the flashbacks. She is having the repeatedly flashbacks since 7 days. Then tell me what is the diagnosis? If the symptoms will present more than 1 month, then it is the PTSD. Symptoms present less than 1 month, then it is the ASD. That is acute stress disorder. So you have to always see the question. Read the questions carefully. Okay, done. Next one, some important antidotes. I think everyone knows about this one, but these are very, 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 very important. Okay, na everyone will do mistake where here. Everyone will make me mistake where here only. I'll tell you. Okay. Okay. Here. See, for the acute iron poisoning, the antidote is the deferoxamine. It is the deferoxamine for the acute. For the chronic iron poisoning, it is the antidote is the deferriprone. Okay, and others is very easy for you, but don't go to exam without reading these. Okay, done. Okay, now yeah, very, 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 very important. Okay, so acetaminophen. Okay, this is the acetaminophen. Okay, na? This is the acetaminophen. This is also called as PCM. Only, na. Next, this is important. This is important. Opiates are important. Always they're giving you in the exam. This is also important. If it is a nicotinic receptor, it is a paliroxine. Okay, these are the important one. Okay. Next one, 58. Raw egg contains what? It contains avidin. That's why see who are the wrestlers. They are great Khali. He's always eating the raw egg. That's why he don't have the hair. Okay, na? See here, avidin, because it binds to glycoprotein and inhibit the biotin, which is helpful for the what? For the hair follicles. Okay. Next one, there is a Kramer's scale here. Okay, it is not a non-invasive visual method for assessing the degree of newborn jaundice by dividing the infant's body into 5 zones. So face here, see is the face, upper trunk, lower trunk, thighs, arms and legs, and the palms and soles here. Remember, if there is a what, the yellow color over the face, then it is how much? 4 to face, F for 4 to 8. Upper trunk 5 to 12, lower trunk 8 to 16, arms and leg 11 to 18, and the palms and soles are more than 15. Always in the examination, they are asking the face. It is the 5 to 8. Next, this is the phototherapy. This image was taken by me only. Okay, na. I was in the night shift at the NICU. Okay, na. This guy, this baby, oh my goodness, he irritates me a lot. Okay, na. I didn't sleep. So what is this one? This is a phototherapy. What happens here? This will convert the bilirubin into what? Lumirumin. Converting the bilirubin into the lumirumin, which can be easily accessed through the what? Kidneys. Okay, na? What is the complication of the phototherapy? It is the bronze baby syndrome. Because the bronze baby syndrome. That's it. Next one. What are the criteria for the physiological jaundice and the criteria for the pathological jaundice? Everyone knows this one. Okay, so I don't want to discuss here. So appears after 24 hours life, within 24 hours life. What is the value of the bilirubin here? What is the normal here? Tell me. Okay, 0.1 to 1. Okay, here. So you have to know about this one. Okay, na? Just read that. Next one, which neonatal reflexes persist throughout the life? Persist throughout the life. This is the parachute. Parachute reflex persist throughout the what? Throughout the life here. Okay, apart from this one, guys, you have to remember some important here. Some important points here. Transfer objects 7 months. There is a here. Sit with support. Sit 6. Sit 6 months. Okay, here. Transfer object 7. Okay, transfer object 7, 5 to 7 months only. And one more important here, social smile is 2 weeks here. Stranger anxiety is 6 to 7 months. Cooing 3 months. Remember this one, handiness appear. Meaning what? What is handiness? Meaning the child came to know that he is right-handed or left-handed. When he is going to appear at the 24th month. When is established, meaning when he will knows completely by 36 months. Okay, these are very, very important. Okay, na? Next one, biochemical assay for the vitamin deficiency state. So vitamin deficiency, I think everyone knows about this one. Everyone is mastered about everyone is pro. Everyone is pro in the vitamin deficiencies and what is the conditions. Okay, na? But they're not going to study this one. That's why I kept this one here. Biochemical assay that for the vitamin B12 assays and test is for the RBC transcriptase. RBC. If you want to know if you're having the vitamin 1 deficiency or not, you have to do the RBC transcriptase test. RBC glutathione reductase. It is for the B12, B2. For the RBC transaminase, you have to do the B6. Remember, pyridoxine causes what? Deficiency causes burning feet. Okay, na? Burning feet syndrome. Okay, na? Next one, figure accession or histidine load test is for the what? Bean and for the folic acid. Okay, na? That's why the women who are pregnant, who are planning for the pregnancy, we have to do the figure test for to know that there is a folic acid or not. Okay, sufficiency or not. Okay, na? For B12 there is serum methylonate level. Serum methylonate levels for the B12. These are very, very important. These are very important. Okay, na? I swear. This will be in your exam also. Okay, na? Next one, 63 here. Remember here. Shadow appearance in where in the what? In the mitral stenosis. Jug-handed appearance in the what? Your AST. Cap of gin appearance in the case of the PDA. Boot shaped in the top. Egg shaped what? GCA, TGA. Box shaped absent anomaly. Figure of 8 are snowman appearance, chap VR. Figure of 3 appearance where compression of aorta. Sitting duck appearance, truncus arteriosus. Bat wing appearance in the congestive heart failure. So these are very, very important. So you have to master this one. Coming to this here, Turner's versus Noonan syndrome. Turner's versus Noonan. Both say there is a short height, obesity, cubitus valgus, webbing of the neck, lymphedema, and a spaced nipples are present. In Turner syndrome, as everyone knows, Turner syndrome, what there is a 40x Okay. Here remember IQ is normal in this case. It is associated with what, Amma? What? Associated with the coarctation of aorta. So, uh, uh, in some questions, they will say that there is one heart condition which is associated with the tunnel syndrome. It is the they are talking about the coarctation of aorta. Known it is a 46X or 46XY. Here the IQ is very low. Okay, it is associated with the pulmonary stenosis. Okay, these are very important. Down syndrome, everyone knows this one. Down syndrome. Remember here the adverse E. Adverse E for 18, E for Edward, E for 18. Rajami 18. And also there is a low set. Okay, na at okay 18 set. Okay, na there is a low set ears. There is a low set ears. Short neck. Okay, here they're going simple Down syndrome. There is I think you know this one. Down syndrome 21. Remember, if you are Telugu, see this is a Patau. In Telugu, it is a Padamudu. It is a Telugu, it's a Padamudu. In Telugu, it's a Padamudu. P for Patau, P for Padamudu 13. Okay, na? That's what remember. Next, Down syndrome, there is low IQ. D for what? D for Do. I mean docardial. This is endocardial occlusion disease. It's also with the endocardial occlusion disease. Okay, na? This one we already studied in our what am I where we already studied in OBG. Okay, they are going to give the images, or else they are going to ask a particular findings. Okay, that's it. 65. What is sling surgery or abdominal cervicopexy? Where we will do it is done for the prolapse that is uterus prolapse. You do the sling surgery. See, sling surgery is best for nulliparous for the young women and for the young women who wanted the pregnancy in the next time also. For the nulliparous, you have to do which is best one is the sling surgery, also called abdominal cervicopexy. But for the older women, you have to do the ward and Myers vaginal hysterectomy plus pelvic floor repair, because in older women, there is a menopause already, so you have to go for the vaginal hysterectomy plus pelvic floor repair. Okay, now I remember this one when I was going to distribute the OT list in my hospital. So I'm reading always that one. Whatever surgery they are performing, I saw there is a ward and they say this is a Myers procedure. Okay, na this means vaginal hysterectomy and plus pelvic floor repair. The next one, 66. Treatment of recurrent ectopic pregnancy. It is a so it is a rupture. Treatment of ruptured ectopic. Oh my goodness. See, if the tube is already ruptured, then what you have to do? You have to see you are not allowed to anastomize. But because if you're going to anastomize that one, because in future it's going to be again the chances of the ectopic pregnancy. There is chance of rupture. That's why you have to always do the total salpingectomy. You have to cut and throw. In case of the unruptured, you have to go for the medical management. In unruptured, you have to your main goal is to save the tube. Okay. So what is the drug of choice here? It is the methotrexate single dose. You have to give the 50 mg. Okay. Let's see here when you have to go with the medical management and when you have to go with the surgical management. See here, for the medical management, if it is HCG value is less than 500, surgical more than 500. Medical size of the ectopic is less than 4 centimeters. Medical more than 4 centimeters. Cardiac activity is absent in medical and present in the surgical. Okay, na? So apart from this, so these are the main. So okay, na? These are the main criteria. Also, you have to remember the doubling time of the beta HCG. Also, you can just read in the few time. Okay. Next one, 67. Route of delivery decided by, see here how to remember this one. See here, if in the twin pregnancy, if the first baby, okay, now if the first baby is what takes, if the first baby is what takes, and another baby is what breach or transverse, then you have to go with what go with the NVD. See, the delivery of the delivery is depends on the presentation of the first baby. The first baby is what takes, then only you have to go with the NVD. If the first baby is not in vortex position, the baby is in breach, and other baby is vortex, then what happens? You are not allowed to do the NVD. You have to go for the CS. First of all, reason first baby, depends on the first baby. The first baby must be in the vortex position. Okay, then let's go. Here, what is the most common is the DCDA. The splitting occurs within 72 hours. It forms the DCDA. 48 days MCDA. 8 to 12 days MCMA. More than 30 days is called the what? Congenital twin. Right? Most common is the trichophagus. Remember, same sex, there is a blood group, same HL typing, but they different fingerprints. Where you will see the twin to twin transfer syndrome? In the MCDA. See, I covered a lot. I covered many things here. Next one, the 60th question. You have to know the which are the disease and the enzyme deficiency. I think everyone are pro. Everyone are pro in this one. Okay, now 1, 2, 3, 4. Okay, total. Do the total 5 diseases. I think everyone knows about this one. Okay, burnt sugar. Okay. Burnt sugar. Maple. Kala sugar. Kala pesab. Black urine. Okay, alkaptunia. Wow, nice. Mutilation. Okay. Mutilation, so not mutilation. Mutilation, it is a what? Leishman syndrome. Wow, nice. Great. Wow, nice. Next one. What is the first step in the treatment of the congenital hypertrophic pyloric stenosis? It is always electrolyte. You have to do the electrolyte correction. You have to do the electrolyte correction only first of all. Then you can go with the Ramsey. Then you have to go to the Ramstead surgery. Remember, I will tell you one story here. Okay, he is Ram A10 olive shape. Ram A10 olive shaped chips. Olive shaped chips. Okay, olive shaped chips. And he, sorry, my writing actually, I'm not having the iPad on here. Okay, don't mind. Okay, he ate what are my chips? See, Ram ate olive shaped chips, and he vomited the exact chips. Okay, now there is no changes in the color of the vomiting. Tell me, see here, Ram eaten chips. What chips? Olive color. Means if you do the X-ray, what happen? There is a what? Pyloric will be what shape? Olive shape. Chips spelling what? CHIPS. This means it is a chips here. That is chronic or congenital hypertrophic stenosis. Okay, na? Who is Ram here? It is a Ramstead surgery. Okay, na? Okay, now why I told that the vomiting is the same? Because it is a non-bilious. Wow, nice, good. Next one, mitochondrial inheritance. See here, he is mother, father. Okay, na? See here, what happened? Here, father affected, then no one is affected. Mother affected, everyone affected. Father affected, no one is affected. Mother affected, are meaning what amma? It mitochondrial inheritance means what amma? It will affect from mother to, if the mother is affected, everyone is will affected, but if father affected, okay na, then no one is going to affected. Okay na, done. Okay, done. So what are the examples? Tell me. Okay, just comment or go to your notebook and see. Okay na, I remember only one, this Mellas something one. Okay na, next one, what is the CURB-65 score for the pneumonia? Okay na, okay na, remember what is score for the pneumonia? It is the CURB-65. Why this CURB-65? In order to admit the patient, in order to admit the pneumonia patient in the ward or in the MICU. Okay, now we have to do the CURB-65 score. Meaning what a mark curve here, C for confusion, U for uremia, R for respiratory rate, blood pressure, age must be 65 more. Suppose example, a patient came to you and your PG told your PG told that to do the CURB-65. Then okay, remember if the patient is having confusion, then give 1 point. The patient is having your like do the lab investigations. If they have uremia more than 7, then give 1. Respiratory, if respiratory rate is the more than 30, then give 1. BP is less than 90, okay, na, then give 1. His age is less than 65, give 1. Then if you got the total of 5 points. Okay, now if you get the 5 points, oh my goodness, then you have to admit the patient in the MICU. 3 to 5, you have to admit the ward. Less than 3, nothing. Just tell him to go home. Okay. Next one, Homocystinuria versus Marfan syndrome. Marfan what there is a defect where fibrillin, there is a fibrillin one defect. Okay, is autosomal dominant here. The intellectual is what here is the normal in the case of the Marfan syndrome. The most common cardiac defect is the aortic root dilation. Remember here what happened? They will say the history that there is a thrombosis. Okay, na? So for example, a patient with DVT. Okay, na? They will mention a patient with the anything he was using the blood thinners or history of the what DVT. Okay, now then this is the conversation. You have to read the question. Read the question carefully. They will give the history of the what DVT. You have to remember this is the perfect point. What deficiency here? Cystatin is in the deficiency, autosomal recessive. Here there is a decreased intellectual. The lens discoloration is that here is the downward and SA is the upward and temporal. This is how you have to remember. Okay, na? Okay, then here. Next, you remember the syndromes and the most common what most common cardiac manifestation. Okay, remember this one. Down syndrome, endocardial cushion defect, Patau adverse, PDA, Klinefelter, mitral wall prolapse, Turner syndrome, this is a bicuspid aortic wall, or what are COA. Okay, these are important ones. Next one, vitamin D deficiency leads to, okay, what vitamin deficiency leads to? Laryngismus studies it is the vitamin D. Everyone knows this. This question came when I was giving the FMGE exam in 2024 July. Okay. Next one, what is screen time? See here the screen time, the first possible point to or final point, critical point is a screen time. Lead time from here to here. Okay, I remember here. Next one, remember this one, disease, toxin, and adulterant. Okay, Kesari Dals, remember the lateral. It is a what is the BOA, which is a neurotoxin, Okay, now is a neurotoxin. Okay, now here it will cause the paralysis. It will cause the paralysis. It will cause the paralysis of the lower limb. So upper and lower limbs. So guys, remember one thing. What is the prophylaxis given for the letharism? It is the vitamin C. Vitamin C. To the vitamin C. Vitamin C you have to give the further prophylaxis. Okay. Remember remaining or to read this one. Okay. Now epidemic dropsies I already discussed in our show shot. Okay. Next one, coming to here. These two questions are, oh my goodness, always in the exam, exam only. Okay, cheppu, bola. Next one, a patient was taking metronidazole for diarrhea. He attended a party where he consumed alcohol. Following this, he developed a red rash, itching all over his body and headache. What is this condition called? Oh my goodness. Okay, now he consumed alcohol and he took metronidazole. Oh, okay. whatever. He first he took metrazole, then he took alcohol. Then what happens? Oh my goodness, this is the clear-cut case of the disulfiram-like reactions. What the hell is that disulfiram-like reaction, Ra? What is that disulfiram reactions? Cheppu bolo. See here. See here. This is the ethanol, Ra. This is, oh my goodness, my writing is thick. But fellow. Okay, see here. Okay, done. Okay. See here. Is ethanol content water ma? Alcohol content is ethanol. Liver, what happens here in liver? It will goes to liver. See, ethanol is going to convert into what ma? Acetaldehyde. Ethanol is going to convert into acetaldehyde. Then acetaldehyde is going to convert into what? Acetate. Convert into acetate. Okay, na? Convert into acetate. Remember, in order to convert the ethanol to the acetaldehyde, what is the enzyme required? It is the ethanol dehydrogenase. It is the ethanol dehydrogenase. What is the enzyme required for the acetaldehyde to acetate? It is the acetaldehyde dehydrogenase. Listening, please listen carefully. Okay, na? Then what happens? Remember here, remember ethanol to acetaldehyde, this reaction is very fast. This reaction is very fast. Coming to this reaction, it is very slow. This reaction is very slow. Okay? That's why see here, whenever the patient, whenever a guy drink the alcohol, it will immediately convert into acetaldehyde. Because acetaldehyde have to convert into acetate. Because this step is very slow, that's why there is a accumulation of the more and more acetaldehyde. It will causes the neurotransmitters disturbances, and the patient will go hangover. He will get what? Vomiting. He will get the skin flushings, headache. This one. Got it? Because after slowly, what happens? This acetaldehyde is going to convert into acetate. That's why whenever that guy who take the alcohol, within few minutes he'll get the kick. Okay, na? He will get the euphoria. He'll get the headaches also. Okay, na? If he will take more amount, okay, he will take more amount of what this happens. So okay, if he took at the night, at the morning time, what happened? Everything is gone. That's why the acetaldehyde is converted into acetate. So what happens, Amma? See, here, see this one. See, disulfiram. Disulfiram is a drug of choice for the withdrawal. What alcohol withdrawal. See, this disulfiram will act where? Will act on the acetaldehyde dehydrogenase. This disulfiram drug will act on where? Acetaldehyde dehydrogenase. If he block this one, oh my God, this reaction is very slow. This reaction is very slow. If disulfide is going to block that one, then what happened, Ra? Oh my goodness, the acetaldehyde condition is very, very high. Okay. This reaction is very slow, Ra. This disulfiram is going to bind that one. This is going to what? Inhibit this enzyme. Then what happens? There is more and more acetaldehyde. Then the patient will feels like, oh my God, very he will get skin flushing, itching, body headache. He will get the test also. The test also will lose the. There is a unpleasant test also. Because of this only. Okay, na? This is disulfiram. Okay, na? See here, that's why, guys, some drugs like glycofulmin, cephalosporins like cefamandole, cephaloperazone, and maxolactam, sulfonylurea, procarbazine, and metronidazole. So, okay, na? See, in the exam they gave metronidazole. Okay, na? So these drugs, if you took the alcohol and you are going to take these drugs, then what happens? This is going to happen. This is going to happen. Okay, okay, done. So now tell me one thing. Now tell me one thing. If a patient is taken a large quantity of alcohol, then what is that? Then what is the antidote for the alcohol poisoning? See, this is the formipizole. This is the formipizole. It will act where? It act at ethanol dehydrogenase, because it will block the ethanol dehydrogenase. Then it will not convert into acetaldehyde. Done. Got it. Got it. Got it. Next one. Next one. See here. See here. Also, that's why I read the question properly. Next one. A 36-year-old divorced man, history of depression, is being treated with the moclobemide. Okay, na? What is this Okay, I don't know this drug. Okay, na? See, I don't know this drug. Okay, na? Okay, done. He took something on drug. Okay, na? On the day of his wedding anniversary, he started what? He started reminiscing about his ex-wife and consumes a large quantity of red wine. Oh my goodness! This is also like disulfiram reactions. Let's see. Red wine. Shortly after that, he presented with severe headache, palpitation, sweating, hypertension. What is the most of management? Oh my goodness. What happened to this guy? He took something. He took some drug. I too don't know what is the drug. But they gave one hint, red wine. Oh my goodness. I know that red wine is containing tyramine. Red wine contains tyramine. Okay. He was giving the symptoms of what? There is a cheese reaction. There is a what, amma? It looks like a cheese. It looks like a cheese-like reaction. It's a cheese-like reaction. Oh my goodness, cheese reaction. Okay, how to identify? Okay, this is the cheese reaction. Whenever there is a MAO inhibitor, whenever MAO inhibitors are taken, if you take the MAO inhibitors, you are going to take the red wines. The tyramine content in the red wines, it interact with the MAO inhibitors. Okay, now inhibitors. See, I don't know the drug. What is moclomide? But I know that, okay, by the history, okay, this is the case of the what? This is the case of the cheese reaction. So other drugs, more emitters like this one, Salagelin, they're going to ask this one. So, muglamide, it is a antidepressant, okay? See here. See, okay, now. Whenever he took the moclomide, is also, see, some antidepressants are also so the cheese reaction. Whenever he took this combination, the tyramine content in the red wine, what happens, amma? It will causes the increase in the production of the epinephrine. It will cause the increase in the production of the epinephrine. That's why he will get the palpitations, sweating, hypertension. Okay. So what is the management? What is the IV phentolamine? IV phentolamine, which decreases the watermark, which suppress the epinephrine and will decrease the watermark, hypertension, palpitation, headache. Done. Next one. Next is the Wernicke encephalopathy. Wernicke encephalopathy and there is a Korsakoff syndrome. See, everyone knows that, okay, Goma. What is Goma? Okay, global encephalopathy, go ophthalmoplegia, amnesia. Amnesia na, ataxia na. Amnesia. Hey, Ataxia, ataxia, and they will forget this. And whenever the examiner they asking what are included in the one encephalopathy, they will say, nystagmus is not there. They, that's very it. Okay, na nystagmus is also present. Next one, they will read only this one encephalopathy. They will forget this one, Korsakoff. In Korsakoff, what is happened? There is a confabulation. Confabulation, what amma? They will tell some false story to cover anything, to cover any talks. Okay, na? A false story. Amnesia, what type of amnesia? Both are present. Retro and anterior is present, but most common there is a retro type. Okay, na? Retrograde amnesia. Done. Next one, see here. Diseases. See, whenever I give exam, they ask this one. See, bicyanosis, bagosis. See here. Baika. Oh my goodness. Okay, baika. See, okay, baika. See here. Bai means bicyanosis, ka means cotton. Baika, basu. Basu means bagosis, su means su. Su sugar, baba bagosis. This is important. Na? These two are very important. Read this one. Next one. What is the most common type of neuroendocrine tumor of the pancreas? See here, neuroendocrine tumor of pancreas here, of pancreas. So, see the insulinoma. Insulinoma. See, what is tumor? There is a what? There is a what? There is a more production. There is a abnormal cell differentiation. Okay, na? Isn't it? There is a okay, na? See, if there is a tumor, if there is a tumor at the what at the insulin, where it's beta cells, then what happens? Then there is more production of there is a more production of insulin. A large amount of insulin will release. What insulin will do? It will attack the glucose, blood glucose. So that's why, oh my goodness, if there is more insulin, what happened? There is a less glucose in our body. It will cause the hypoglycemia. Hypoglycemia. This is the Whipple. This is called a Whipple triad. This is the insulinoma. It's a symptoms of hypoglycemia, dizziness, vision changes. Okay, everything will be there. Next one, glucagonoma. If there is a glucagonoma, what happens here? A glucagonoma, it is a alpha cells. Glucagon, if there is tumor there, it will produces more glucagon, more glucagon. Then what happens here? He will increase the blood glucose levels. He will keep on increasing, keep on giving glucose. There is a more glucose. There is more glucose in the body. Okay, now it will causes the what? It causes the diabetes. Causes the the 4D is called the diabetes, dermatitis, DVT, and the depression also. See here in that there is because of more glucose, it causes the what? Necrolytic migratory erythema. Please see the image. Please go now and check the. Please go now. Go now and type NME in glucagonoma and see the image. Sometimes they are going to give the image. You have to go. Okay, na? Then you have to use this one also. Okay, next one. This next one 82. Which is the most sensitive and the least sensitive? Oh my goodness. See, this is very important. Okay, na? Most sensitive. Actually, I have taken this slide. I think everyone knows this one where I taken with here. Okay, see this one. See this one. What the most sensitive cycle is the what? Cell cycle is the G2M. 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 Okay, na? See, see here. Most sensitive what? G2M. With G2 of M phase. Least sensitive what? S. Least sensitive is the S phase. This is the one question. Coming to the tissue, least sensitive is what? CNS. CNS is the least sensitive. These two are very important. Coming to the structure of eye, More sensitive lens and least sensitive is the sclera. Tumors, more sensitive Ewing sarcoma, least sensitive osteosarcoma. This is very, very important. Next one. Types of necrosis. I love coagulative. It in the what? Is the see. Next is the coagulative. See, cognitive never involves the brain. Cognitive never involves the brain. Cognitive examples are kidney, heart, liver. Necrosis, this is a cases necrosis in the histoplasmis, TB, sarcoidosis. These are okay. You guys, I think you guys already ratta maar diya hoga, okay? Already. So you read this one. Next one, read this also. Types of vasculitis here. Okay, na? Types of vasculitis are very, very important. Okay, na? What is they're going to give some give the case scenarios. See, this is important. This is important. Giant cell arteritis is important. Kawasaki is important. Kawasaki disease is very important, and HSP, Henox-Stern purpura, is very important. There they will ask you one question here. Remember, when you have to give the steroid. When you have to give steroid, tell me when when it involves the GIT. Okay, that's it. Okay, very important. Okay, now read this one. I think you already mastered this one, but I'm just reminding once again. Okay, now types of cataract. Okay, everyone will know. Okay, celiac cataract in atopic dermatitis. They will give the image. Okay, now they will give the image, and you have to see. Okay, image. Okay, this. Okay. What are they? Read properly. Okay, now next one. These are some PNS. This is a paranasal sinuses. Here, X-ray PNS. This is the Caldwell view. Caldwell view. Chin will up. Chin will down. Chin will down. Because what? To see the what? Chin down. To see the what? Frontal sinus. To see the frontal sinus. It's best for the frontal sinus assessment. Waters view. It is the Waters view. Waters view is for the what? This for the chin up. For the chin up to see the what maxillary, to the maxillary sinus assessment. Okay, na? See the W reverse, it is will become M, which is maxillary. It will become maxillary. This is a maxillary sinus. Okay, na? Maxillary sinus. Okay, na? Maxillary sinus. It will become maxillary sinus. Okay, na? Oh my goodness, 1 minute. Okay, so it will become okay now maxillary sinuses. Okay, done. Next one, this is the Perris view. What this is also done in the same way of the Waters view only, but here what happened? The mouth will be open. The chin up only, mouth will be open. Okay, to assess the what sinus? Sphenoid sinus. Next is the lateral view. For the all four sinuses, it is for the pneumatization. That's it. Wow. Oh my goodness. Next one, types of abortion. The first one is the threatened abortion. Tell me what is the definition of recurrent abortion. Hey, Mister, you only tell me recurrent abortion. Comment karo. Next one, threatened abortion. What is the most common cause of abortion in the first trimester? Type karo. Next one. What is threatened abortion? It means there is a threat. Oh my gosh, there is a threat to the baby. Meaning someone tell, oh, I will kill you. He's giving warning. But there is nothing. So this is threatened abortion. Okay, na? Actually, on the ultrasound there is a fetal. The fetal is viable here. So okay, now only 5% will go to the abortion. Okay, only. Next one, inevitable. Meaning, oh my goodness, abortion how to done? Abortion will happen. Abortion will happen. Incomplete. There is what extremely heavy bleeding and plus passes up small tissue. Notice small tissue. See, meaning the tissue will not come. The tissue will not come all, but only few will come. Remember here, there is a missed. See here, see what happened, Amma. Here, there is a missed bleeding. There is a missed bleeding. There is a missed, see, missed abortion. There is no bleeding. Because you know what happened? The cervix is already closed because the fetus is already died. The fetus is already died, but that is there is no content because in the ultrasound we'll see the what amma spalding sign. You'll see the spalding sign. Very important spalding sign on the ultrasound. It means it is a fetus death. Okay, na? Okay. See, I'm not going in detail because this is the one liner. Okay, na? See, this is the what amma open your this is okay or what your it is your what amma anatomical snuff box. In olden days, they will put here cocaine muffin. They will snuff like this. They will snuff. They will snuff. That is called as anatomical snuff box. Oh my goodness. Okay. Give what is your anatomical position? This one like this or another position. Keep this one like this one. This is your lateral side. This is your middle side. Okay, now this is your lateral side. What happens, Amma? You did like this. This is the what it is. This is the adduction. This is the abduction. This is the abduction. Adduction, abduction. See, this abduction. This is the abductor pollicis longus. Pollicis means what, Amma? What thumb? Okay, now abductor pollicis longus and the extension pollicis brevis. The what lateral side and middle side. What we did is the extended position. Extension pollicis longus. What the roof is the cephalic vein, a superior superficial radial nerve, and the content is the radial nerve. Okay, and done. Tata. Next one, the 89th one is see. Oh my goodness. See, I included many things here. Okay, na? Type 1 collagen, see, type 1 collagen, B bone, 1 B 1 bone. Type 2 collagen, study like this. Cartilage, artery. Type 4 is painted the floor, the best member. SGLT1, SGLT2, SGLT3. SGLT1 at the PCT side, the kidney, at the PST, at the okay, na, intestine. SGLT2 at the PCT side, kidney. SGLT3, skeletal muscle and the intestine. Can tell me what is the drug? What is the drug which inhibit this? What is the drug which inhibit the SGLT2 inhibition? Tell me. Comment karo. Okay. Okay. Done. LDH L1, 2, 3, 4, 5. But do ratta maro. Next, gluta 1, 2, glut 1, 2. See, 2 is insulin dependent. 2 is insulin independent. 4 is a dependent. Fructose transport, glut 5. These are important. See, glut 3, R3 is see, nerve. Nerve is what am I there? Glut 3. CKMB, CKBB, CKMB, CKMM, CKMB. Oh my goodness, this is the remember this one. Ratta. Next one is the metabolic compartment. Where does the glycolysis happens in the cytoplasm? Okay, cytoplasm. In the cytoplasm, we have glycolysis, HMP-son, cholesterol synthesis, protein synthesis, and the cytoplasm. Both were heme synthesis, your cycle. Sometimes, okay, na, these are the questions they're going to ask in the exam. How to remember this one, okay? Remember, antenatal care is recommendations. Ideally, it is 14 ANC is required. How much? 14 ANC. 14 ANC is required. According to Government of India, 4, at least 4. According to WHO, it is the 8. Remember, normally, what is the dose of folic acid? It is the 400 mcg. It is the 400 mcg. But in the case of the Anemia Mukta Bharat program, it is the 500 mcg. And please comment below. What is the dose of the iron in the Anemia Bharat program? Bolo, type karo. Next one is the patient having the previous NTD, neonatal defect, and a CGS, then you have to give the supplement. How much? 500 mcg. And the patient is having the previous history of NTD, and also if they want to do the pregnancy, plan for pregnancy, they have to take the folic acid for at least 3 months. Okay. Yes, this one is the adrenal gland. We have in the adrenal cortex and adrenal cortex and medulla. Adrenal cortex, we are having the GFR, 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 G for glomerular, F for fasciculator, R means reticularis, GFR. GFR, cortex, glomerular, fasciculator, reticularis. See what is happening. What is the enzyme is? What is the hormone is coming from the glomeruli is the aldosterone from the fasciculator coming to the fasciculata cortisol cortisol reticularis is the what sex hormone reticularis see it's the sex hormones coming to the medulla it's coming to what epinephrine norepinephrine. Wow, nice. They will give this image in your examination, or they will mark there. They will tell what hormone is coming here. What is the layer here? Remember this layer. Very, very important. Next one, 93 ETC complex inhibitors. Oh my goodness. See, here phenobarbital, one here, rotenone. The complex one is inhibited, phenobarbital and rotenone. Complex 3, antimycin, ball. Physiological uncomplex, brown fat. This is the thermogenesis. Remember these complexes are very important. I don't know how you're going to remember, but do batti. Okay, na? Next one, anti-4. Oh my goodness, this is the CD4 count is the 500. It is the 500. In what cases it is? What are tuberculosis cases, herpes simplex is the 500. Remember, these are very important one. This is the less than 200 case of the pneumocystis in the pneumocystosis, toxoplasmosis, and the cryptococcus in the mycosis it is less than 200. These are very important. These are important. Okay, na? But you have to master all these. You will get one MCQ for sure. Next one, color blindness is type of inheritance. Oh my god, it is a color photo. No, see, it is the X-linked. It is the X-linked. It is the X-linked. Remember, all the enzyme deficiencies, the diseases are always they are autosomal recessive only. Okay, na? Remember, this is not all time, but remember, if you don't know, just mark the enzyme. Okay, mark the AR. Next one, A beta lipoproteinemia. Oh my goodness, here there is a deficiency of the watermark APO B48 and APO B100. Oh my goodness, and there is complete or the absence of column make us VLD, LDL. That's why there is a malabsorption. That's why there is a malabsorption. There's a fat malabsorption. There is a statutory and a failure to thrive. For this one, guys, you have to give the restriction of long chain fatty acids, the large dose of oral vitamin E given. Okay, done. And so 97. Oh my goodness, this is the first arch is at what amma? Malleus incus mandible. Malleus incus mandible from the first second arch step is second arch step is S for second, S for the second arch for the fourth arch the left arch of aorta, fourth arch the left arch of aorta, sixth arch the left ductus arteriosus. Done. First pouch, middle ear cavity. Say hey, okay. Everyone knows this one. Every LKG student also knows this one. Remember here. And also remember this one, transparent place here at L1. Okay, na? L1 is okay. Done. Everyone knows this one. Next one, coming to the FBS, RBS, HB1C. Oh my God, so what you are telling, guy? Bro, I am not a first class student. You are telling me about FBS. I don't know about this one. I know then what is the normal values. Why are you teaching me this? Okay, because they will give this one as a case base. You have to tell me, you have to tell either it is a pre-diabetic or not. Okay, na? That's why. That meaning you have to know everything. Remember here, this one everyone knows. See, this is the HB1C. Normal is 5.6. Remember, see here. Remember 5.6 to 6.5. You see, panja chakka panja. Panja chakka panja. This mnemonic is given by Dr. Ashish sir. Thank you, sir. Okay. See here from the NLC. Okay, now see normal how much 5.6. Reverse this one, it will become 6.5. My goodness, normal is 5.6. Reverse this one, it will become abnormal. Meaning normal is 5.6. Normal is 5.6 and diabetic is 6.5. Okay, done. And remaining is pre-diabetic. What is the best for the sugar control? Is the glycated. This is also glycated glucose is the what amma? It is the best. It is for the 3 months. It is up to 3 months. It will take the sugar level to 3 months. HbA1c. Target HbA1c is plus 7 for the treatment. If you want to know the best is the HbA1c. Best if you want to know the current, if you want to know the current glucose level, you have to do the FPS. Okay, done. So yeah, we reached the final point. Next one. What is ASA guiding? Oh my goodness, this one. Meaning what, Amma? If you suppose example, if you are diagnosed with the appendicitis, if you are diagnosed with the appendicitis, and you are going to have the operation tomorrow, then today anesthesia will come. Anesthesia will come, and they will tell you, okay, man, do you have it's okay. Do you have anything? Do you have BP? Do you have sugar? Do you have any heart cardiac conditions earlier? If the patient is healthy, they will keep the what? They will give, first of all, they will do it is the ASA1. If the patient is healthy, patient is brain dead. Oh my goodness, is the 6. Mild disease, grade 2. This is grade 2. Okay, now morbid is about to death is a grade 3, 4. This is how you have to do that one. Okay, next one is the Mallampati score. Mallampati score is there to assess the airway before the surgery. As you know, the anesthesia PGs they're going to do the Mallampati score. They're going to just they will tell the patient to open the mouth. Can you tell me? Can you tell mine? Can you tell? Can you tell? Can you tell ma? Tell me. It is grade 1, class 1, class 2, class 3, class 4. Tell me. Comment below. Okay, na? See, in class 1, guys, it is what happened. It is why we are doing this Mallampati score, because in any conditions, if there is chance for the intubation, it will easy for the intubation. Okay, na? Class 1 is complete, all visible. See here, hard, soft, and uvula, and everything is visible here. Here only the tip of the uvula is not visible. Class 2. Class 3 here only base is seen only. Here everything everything is not visible, because see, first one is the best prognosis, last one is the worst prognosis. Okay. Next one. What is the compression? What is the compression? Oh my goodness, what is the compression? In no advanced airway, it is the 1, 2, 3, 4, 5, 6, 7, 8, 9, 20, 40, 30, 29, 30. 1, 2, 3. This is the 30:2. 30:2. In the pediatric, it is 15:2, and the neonate is the 3:1. See, yeah, CPR is very, very important. Please try to read the CPR guidelines in a very correct way. Okay, thank you, guys. Please also watch my Pharma 100 one-liners are very, very important. Important, and also watch the all the bodies. All bodies I already discussed in our YouTube. Okay, that's the culture minutes. Okay, thank you. If you have doubts, please don't forget to call to this number. Text me before calling, guys. Okay, thank you very much, and good luck for your examination.